The FDA just approved an at-home device for difficult-to-treat depression, and today we talk with the lead investigator on the trial, Linda Carpenter. Welcome to the Carlat Psychiatry Podcast, keeping psychiatry honest since 2003.
I'm Chris Aiken, the editor-in-chief of the Carlat Psychiatry Report.
And I'm Kellie Newsome, a psychiatric NP and a dedicated reader of every issue. On January 12, 2026, the FDA approved the first at-home device for difficult-to-treat depression, ProLivRx. The decision came just a month after another historic approval, the Flow device for general depression. Whether you are a psychiatrist, a PA, or a psych NP, these therapies are going to change how we practice, bringing a third path, neuromodulation, into the office, alongside the well-trod paths of psychotherapy and psychopharmacology. But unless you've been working in a TMS clinic, this is probably an unfamiliar path. So let's start with some basics. Neuromodulation is when you change or modulate neuronal activity. We do this already with medications, which is sometimes called chemical neuromodulation, but usually we say it to mean electrical neuromodulation, which includes ECT, TMS, even the TENS unit for pain. Those are all non-invasive, meaning there is no surgery or implant a device. But we also have invasive neuromodulation in psychiatry for depression, deep brain stimulation and vagal nerve stimulation.
These new approvals, Flow and ProLivRx, are both electrical neuromodulators. Like TMS, transcranial magnetic stimulation, they are non-invasive, but unlike TMS, they can both be done in the home without a technician present. Both are bands that the patient wears around their head, but this is where their similarities end. They operate through different mechanisms in different parts of the brain. Flow is a brand name for transcranial direct current stimulation, also known as TDCS. We know a lot about TDCS already. Patients buy these machines off the internet and they use them at home. And around 30 randomized trials tell us that TDCS works in depression. What has been missing, though, is federal approval, and with that, the better regulation of these devices. Flow brings us that. It looks like a pair of Bose headphones with the headphones over the forehead, and that is where it delivers the electricity to the left frontal lobe, the seat of depression. Flow is FDA approved for general depression, and even though the FDA allows its use as an adjunct to antidepressants, it is not approved and not known to work for treatment-resistant cases.
That is where ProLivRx stands out. This device is for patients who failed at least one antidepressant medication. In the trial, the average number of failed meds was 1.8. ProLivRx also stimulates a different part of the brain. Instead of stimulating the frontal lobe directly, it aims to alter brain function indirectly by stimulating the sensory nerves, the occipital and trigeminal nerves. But before we get too deep into the mechanism, let's talk with Linda Carpenter about when to use it, how to use it, and the pivotal study behind its launch.
Hi, Linda. Thanks for joining. Oh, and I see you have the ProLiv device in your hand. Tell us how it works. How do people wear it?
The Neuraleaf device sits on your head and it has sponge electrodes, which make contact with branches of the trigeminal nerve. And in the back, it has electrodes that are in the back of your head through your hair, and they're making contact with the occipital nerve, which is this nerve that runs up the back of your neck. It focuses the stimulation on the nerve branch. And so then the nerve branch conducts the impulses down into the brainstem and up through areas of the brain that regulate depression. The trigeminal nerve goes down to the brainstem to this area called the solitary tract nucleus. And other treatments that we use for depression that have a similar mechanism are like vagus nerve stimulation, which is an implanted device. I have one of those too here. So the new technology is finding these peripheral branches that go to deep cranial nerves and have pathways to these areas in the brain.
Linda, you were involved in the trial that got this ProLiv approved. I have it here, and the Journal of Brain Stimulation just came out, along with Mark George, who did some of the original TMS trials, Nancy Navarro, Lisa Deutsch, and Andrew Luchter. And a couple things stand out to me about this trial. First is that none of those authors work for the company that makes ProLiv. Another is the effect size. It's a large effect size, around 0.8, which is similar to what we see with IV ketamine. And making that effect size more believable, the blind was intact. So patients were not able to tell if they got the sham stimulation or the real thing. So how did you make the sham stimulation so believable in this trial?
It's not hard to make a good sham when you're doing take-home stimulation device, because with these stimulation devices, what they do is with the sham, looks, feels the same, the person puts it on, it actually stimulates at a slightly different frequency. That's not the secret sauce. It's not the therapeutic frequency. The patient can feel that they're getting stimulation. So it's very hard for them to guess whether they have the active or the sham device. We did our study on patients with major depressive disorders, the indication, and our patients had failed to respond to antidepressants. So they would be in that, pharmacoresistant kind of category. And also they were on an antidepressant, and this was used as an adjunct. The ProLiv stimulation, which they used at home for 8 weeks, was used as an adjunct to this. For flow, they weren't necessarily people who had failed to get better with medications. So it could be your first episode of depression, your first treatment.
And I understand the approval was based on this one trial, which is a little unusual for the FDA, which usually requires 2 trials. But this one was done on a breakthrough status based on the novelty of the treatment and the need in treatment-resistant depression. So tell us about the kinds of patients you enrolled in this trial, which involved, I think, was it 124 patients?
We did our study on patients with major depressive disorders, the indication, and our patients had failed to respond to antidepressants. So they would be in that, pharmacoresistant kind of category. And also they were on an antidepressant, and this was used as an adjunct. The ProLiv stimulation, which they used at home for 8 weeks, was used as an adjunct to this.
And this is different from Flow, the new TDCS device, which is not approved in treatment-resistant cases.
For Flow, they weren't necessarily people who had failed to get better with medications. So it could be your first episode of depression, your first treatment.
And while ProLiv has just this one study, there are a lot of other studies behind Flow using other transcranial direct current stimulation devices. Some of that research I understand you were involved in. And the big picture there, it looks like to me that Flow or TDCS really doesn't work in treatment-resistant cases. They've tested it. Some of those trials failed. If anything, there's a small effect size that might come out there, but this isn't where we go for treatment-resistant cases. And instead, what this approval of Flow is bringing us is finally an approved, reliable device that we can use instead of the do-it-yourself, buy the parts off the internet kind of devices that we've seen used at home for TDCS.
Exactly. You exactly described Flow, because as you know, as you've pointed out, there have been many trials of TDCS in depression with different sort of devices, and they have a lovely device and data to go with it. So not treatment resistant. So for patients coming into the Neuraleaf trial, many of them had, already tried and sometimes even failed to get better with treatments like TMS. So it certainly could be something that you used earlier on, but your patient's at least already on some antidepressant.
And would you consider ProLivRx before TMS?
I'll probably try it before TMS because, these are patients, some of whom had already tried TMS. Some of the patients in our study had TMS and they got better, but then they got sick again. And instead of going back to TMS again, they wanted to try something else. So that's another group, because it's more convenient to use something at home than to come to a clinic. TMS requires you're there 5 days a week for 6 weeks in a row, sometimes longer. And it's a great treatment, but it's prohibitive for so many patients.
Well, one thing that's kept us from using TMS at home is it takes a lot of power, not more power than the average home has. So how does ProLiv get its juice?
ProLiv is plugged in and charged with a little USB. You do that right at home, and then it's got its own little internal battery. So it's not a lot of electricity. You're absolutely right that one of the rate limiting steps for having magnetic stimulation at home is how much energy has to go through a coil and a thyristor to make these like pulsed electrical impulses that will generate a magnetic pulse. So here we're talking about low intensity electrical current.
Wait, it's time for the CME quiz. Earn CME for each episode through the link in the show notes. Which population is ProLivRx approved for? A. Major depression with one or more antidepressant failures. B. Major depression after 2 or more antidepressant failures. C. Major depressive disorder, moderate to severe. D. Major depressive disorder recurrent.
So you take a patient with treatment-resistant depression, what would make you turn to ProLiv instead of, say, augmentation with aripiprazole or lithium?
Chris, that's an interesting question. And it's such a personalized answer because for some people, it's just easy to take a pill every day. And that is a perfect place for them to start. For some people, the side effects associated with our available antidepressants are totally unacceptable. And so they'll start them and then they can't stand it and they go off and then they continue depressed. If it's not working, we have to think about the next step. And when we think about the next options, when medications aren't working, for many years, we've had to just go next med, next med, next med. And people go years for trialing different meds. Maybe one of them, works or helps them a teeny bit for a month and then it stops. But now, as we have more of these different types of treatments that have different targets trying to get into the pathology in the brain. And so now we've got more and more of these to try. And then again, it becomes issues of patient preference. And I hate to say this, but the other thing that will really determine what people pick next is the cost.
We don't yet know anything about cost or insurance coverage around ProLiv, but it'll probably be sold as a subscription model. What that means is that patients won't be able to activate it or use it without the app on their cell phone, and the app is going to be controlled by the company. So the patient is essentially going to need to get refills from their doctor to have regular visits to keep that app activated, and there will probably be a cost which we hope insurance will cover for the use of the treatment. So I suppose that maintenance will be possible with the treatment. There'll just be an extra cost to reinitiate it. But what do we know about the need for maintenance after an 8-week course?
You're right. There are chronic illnesses. Depression is like diabetes, and it's rarely going to be the case, at least the kinds of patients that we treated in this ProLiv trial. They're patients who are going to need maintenance. How soon or how far apart? That's something that our field needs to work out and research some ways to determine. I was really delighted to see in the ProLiv study that we set it up so that there was a maintenance schedule, which allowed people to continue to get treatment.
Are all of the treatments going to be done at home, or are we going to monitor some of them in person?
Well, one of the things that we anticipate with this is that the first use or discussion about it will be in an office or in a telehealth visit where you can make sure that they understand and try it and have competence with putting it on and fitting it and, know how to turn it on and help them interface with their smartphone. The smartphone is great that when it interfaces with the device, it gives you step-by-step instructions, and it's also Bluetoothing to the device. So it's, reading impedances tell you when things can start and when things can stop. ProLiv has this interface, not only with the patient's app on their phone, but it also sends information to a cloud. So the physician in their office can be monitoring adherence, how often the patient's using it, if the impedances are good, whether, you want to make sure that your impedances are good so the device is functioning and getting the right amount of current in the right place. And so, the model that we anticipate is that doctor prescribes it, and then they continue to monitor the patient either by telehealth or by inpatient visits periodically, every couple of weeks, every month, whatever the clinical need is.
In the studies, the sessions were done 40 minutes twice a day with at least 5 hours apart between the two sessions. And I noticed there was some flexibility there. It said it was done 5 to 7 days a week. How much flexibility did you actually allow in using this device?
I used it twice a day, but they had a little bit of flexibility, whether they were using it a little more at one time than a little bit less than the other.
I understand the device has an accelerometer in it to monitor the patient's position, and part of the reason is that they can't use it if they're upside down. Are there any other limitations in what they can do while using it?
No, you can eat or move about. Because all of these devices involve electricity, we don't want you to go in the shower or take a bath while you've got a device on your head. My recommendation to anybody that's getting brain stimulation is to think about what they choose to do while they're wearing it, because there's some evidence that there's synergistic effects between stimulation and what your brain is doing. Not necessarily with this device. I can't say like we did a study of what are you doing while you're wearing this? But in the TDCS world, certainly there are devices and studies where they've evaluated interaction between what you're doing and the stimulation generate the result. So my recommendation would be for people to do things that are not highly stressful, do it when they're relaxing, watching television. It wasn't studied as a device that what you wear when you sleep. So we don't really have data yet to say, these sorts of things, this is what you should do when you're sleeping.
So we're aiming for 2 40-minute sessions, 5 hours apart. And is any time of day okay?
Any time of day is okay. And that's one of the great things, the convenience home. I guess people could use it in work if they have the comfort and privacy of where they work. If they want to wear it in public as they're walking around in the subway, there's nothing to prohibit that. It's not a sort of a interrupting or distracting experience. It feels quite good, actually. It's got this sensation that you feel on your scalp. Sort of like, those metal things that they take that go like this, and they kind of send little shivers up and down the back of your neck.
Yes, they're not electronic, but you're talking
it's a scalp massager,
Scalp massagers for $10. They're like little wires.
Yes, yes. Well, when you put this on, at first you do get a little bit of that sort of sensation in your scalp, and it makes a little bit of a feeling down the back of your neck, and it's quite nice. So it's a relaxing feeling, and it's not a distracting experience so that you would say like, oh, I can't read while I'm wearing this. You certainly could read or be on your computer.
Are there any side effects to ProLiv or just things patients didn't like about the treatment?
Yeah, one of the things that we experienced is that people need to learn how to set up the device with the right size so it fits on their head comfortably, right? So it has to make contact in the back and contact in the front. And it's adjustable, and you want to get it not too tight. So you feel like there's something constricting your head, because that can be annoying if something feels like it's a tight band around your head. You want it just tight enough so that it's touching and not too tight. The other thing is with this device, patients titrate the level of intensity themselves. We encourage them to go up and then until it feels uncomfortable, and then back down so it's comfortable. And there's always somebody who thinks more is better, it should go higher, higher. And you don't want it to be uncomfortable. That's not good. You shouldn't push it to the point where you're feeling, stimulation that gives you a headache. And that would be a risk that you could have a headache. If you didn't properly moisten these little sponges inside, and if it's, against your skin and the electricity is trying to get it could make redness or even kind of a burning sensation. But I think burning's a little bit extreme. But you could get like a redness or an irritation. So again, that's all part of the training to use the device and make sure that somebody, you can see them walk through the steps. They know how to put it on, how to be comfortable, how to not turn it up too high. It'll time out, so it won't let you use it too long in each session. But those are the main things. Those are the main side effects are basically the contact, whether you get a headache, if you've got it too tight, or you don't have the good contacts and you get some irritation on the skin. Other than that, we don't have any evidence of interactions with medications.
Thank you, Dr. Carpenter.
Join us next week for more on ProLivRx as we continue this interview with Linda Carpenter. Dr. Carpenter is a professor of psychiatry in the Alpert Medical School of Brown University and chief of the Mood Disorders Program at Butler Hospital. She has conducted NIH and industry-sponsored trials on vagus nerve stimulation, deep brain stimulation, transcranial magnetic stimulation, transcranial direct current stimulation, and esketamine. Do you have topics you'd like us to cover? Send your feedback and questions of all things psychiatric to asktheeditor@thecarlatreport.com. Visit us online at thecarlatreport.com, where we have a special offer for our podcast listeners. You can get $30 off your first year's subscription to the journal with the promo code podcast.